So coming to the causative factors for the peptic ulcers are the duodenal and gastric ulcers. So the people used to think the stress or certain food could cause the ulcers. So because of the before the research studies, so most of the people believed that, and also spicy food and also stress also one of the causative factor for the causative factor for the peptic ulcers. But after the research, so they identified so the stress and also spicy food is not a exact causative factor for the peptic ulcers. So it's not is completely declared that the spicy food may chance to give the peptic ulcers. But researchers haven't found any evidence to support those theories. Instead, studies have revealed two main causative factors. So only researchers. So instead of these studies, so they revealed only two main causative factors. The two main causative factors are the one is the bacteria, that is the Helicobacter pylori, and also next one is the pain relieving, that is Nsaids medication, non-steroidal anti-inflammatory drugs. These are the two major causative factors for the gastric and also duodenal ulcers. So how this Helicobacter pylori is the causative factor for the peptic ulcers. So this is going to be some effects in the infects the stomach. And also this one is about 50% of the people are in the 50% of the world population has this H. pylori infections, often without any symptoms. So researchers believe that people can transmit this H. pylori from one person to one person, especially during the childhood, because of the transmission of this bacteria may chance to get in the childhood. If they share any food from if they share any vessels, or because of the spoon or fork, or maybe any like a food material or food boxes, may chance to get this H. pylori bacteria. And also this bacteria stick to the layer of the mucus in the digestive tract, causes the inflammation. So if after infecting this H. pylori, so it's going to give the inflammation, and also it's going to irritation to the mucosa of the stomach. So which can cause the protective lining is going to be breakdown. If you see the inside the stomach is having the layers of the walls are going to be producing these mucus secreting cells. So because of the damage of these secreting cells, these layers are going to be decreasing the mucus productions. So this breakdown problem causes the stomach contain the strong acid is intended to digest the food without the mucus layer to protect it, and the acid can eat the stomach tissues. So because of the damage of these protecting layers in the stomach, so because of these protecting layers, if there is no protecting layers, so the acid concentration is going to be increased inside the stomach. So if any acid concentration is increased, so this acid is going to eat the tissues. So it leads to the ulcer formations. Eat the tissues means it's going to break down the tissues. So because of, if the mucus production is there, so this mucus is going to protect from the HCl concentration. So if there is no mucus secretion from the secreting walls, so it may use the acid concentration is going to increase. So because of the acid, so it's going to damage the stomach walls. So it gives the ulcerations. However, for the most people, the presence of the H. pylori doesn't have the negative impact. Only 10 to 15% of the people is H. pylori end up developing the ulcers. So many people are going to get these infections, but it's not going to do all the people are not going to get the ulcers formations. Only 10 to 15 percentage of the people only is going to get the ulcer formations. So it depends upon their immunity and depends upon some associated risk factors. So who already having some other complications such as the intestinal disorders and also liver and also stomach and also pulmonary and also kidney diseases. So these are going to be associated with these diseases, and also those people may chance to get the ulcers in the gastric and also duodenal ulcers. So that is the H. pylori is the infections. And also another causative factor for the peptic ulcers is the painkillers. So these painkillers, especially the non-steroidal anti-inflammatory drugs, so these drugs are going to, who are addicted or sometimes who are using prolonged time, so it may chance to get the damage of this intestinal mucosa or in the stomach mucosa. So because of these medications may damage the stomach walls, so it leads to the abnormal secretion in the mucus. So it also gives the ulceration formations. So these are can wear away the mucus layer. So this also the damage the mucus layer of the digestive tract. So these medications is a potential cause of the peptic ulcers. So especially is the aspirin, naproxen, ibuprofen, and also is going to be the Nsaids, especially Celebrex, Cabina, and also these are going to the main causative factors for the damage of the stomach wall damage. So it leads to the peptic ulcers. And also other rare causative factors are going to be if anybody the heal from the previous infection. So that means if any immune system damage. So if they're not like they're not strong, or maybe if any heal disease conditions may chance to get the, because of those people are going to take the more medications, and also this type of medications also may alter the gastric secretions. So it leads to the peptic ulcers. But major causes are the only two causes. Those are the H. pylori bacteria, that's a bacteria, and also these painkillers. And also other rare causative factors are the having surgery and taking other medications such as steroids. So in case of anybody having undergone for surgery, and also is going to, if anybody using the steroids also may chance to get the peptic ulcers. And also other causative factor for the genetic links. So that means who are having the predisposing factors are especially the blood type. The blood type who are the more susceptible for the peptic ulcer is the blood is a O group, that is a O positive and negative. Then that, so these people are may chance to get the peptic ulcer, then the A and also AB positive, positive or negative. And also these peptic ulcers are associated with any other diseases such as the is a chronic pulmonary disease and also chronic renal disease. So especially the duodenal ulcers are going to be associated with this pulmonary disease and also renal disease. And another causative factor is the stress. So who are prone to like a more stress, or who are already having the anxiety or depression and stress. So this also may chance to get the peptic ulcers. So these are going to be, so these ulcers are which are clinically different from the peptic ulcers. The ulceration in the mucosa that can occur in the gastroduodenal area. So these ulcers may occur in patients who are exposed to stressful conditions. Though these are going to be slightly different to the peptic ulcers, but it may also going to damage the stomach walls and also intestinal mucosa. It may use the same symptoms like gastric ulcers and also duodenal ulcers.